most important thing we have to do is to restore the readiness of the force. And right now, of course, as you know, we're under a continuing resolution.
How can we do less, do it better, do it faster, and be more efficient, be more lethal, and ultimately create a more ready and lethal joint fighting force?
How do we ensure that the young captains, the young airmen, the NCOs of today and tomorrow have that same confidence under fire that I had when I went into combat in Desert Storm?
One of the major problems facing the Air Force Medical Service right now is currency and readiness, and it is not unique to RAF Lakenheath. It is a problem that is facing all of our services around the world.
Because you can't teach experience. You just can't. You have to be, you can talk about surgery all day, I can talk about my deployments all day, but until you actually do it, you don't know what you're doing.
You want surgeons operating on you who know what they're doing. You don't want surgeons who are not current or not proficient in surgeries that they've learned how to do, but they just haven't had the opportunity to practice because of the active duty population that we have.
Here at RAF Lakenheath, we've taken advantage of a national health service that allows us to work in a similar environment with a common language and similar training backgrounds in order to bridge this gap for what we have currently for currency and readiness, to making sure that our medics are continuously ready to deploy at a moment's notice.
Lakenheath gives our airmen the foundation. Having this partnership with West Suffolk gives them the experience to be able to work with different people, work with what they have.
So in my experience from being deployed to Afghanistan, it is very important that you're able to be adaptable and flexible. Working in the NHS allows those skills to develop because you don't know what you're working with, you don't know what situation you're walking into, you don't know who your staff are going to be necessarily.
For us, this is a really, really important programme. We're heavily invested in it. We see some fantastic outcomes. We see some fantastic sharing of ideas. We see real improvement happening as a consequence of the sharing of lessons and people. We're absolutely committed to it. We want to do more of it, and we think this is an international, innovative programme that is really unique and must be supported.